To go to the emergency room or not to go to the emergency room? It's a question that unfortunately has crossed the minds of so many through the course of this pandemic. From COVID-19 patients to those with minor coughs, emergency rooms are seeing a gamut of patients, keeping doctors and nurses busy. So is there one specific way to find out if you should make your way down to the ER? Dr. Jeff Davidson, medical director and chairman of Valley Hospital Emergency Department, agrees it can be confusing.
All of the hospitals and emergency departments in the Valley are very busy right now. That said, we always have the capacity to take care of those individuals that need our emergency departments, and we always have staff ready to care for them.
They never want to dissuade a patient from seeking emergency help, but in some cases, an urgent care might be just as helpful.
Illnesses and injuries that urgent cares are really good for, and some of them are the more minor. You have to remember that they don't have the specialist trained emergency medicine nurses, emergency medicine physicians, and they may not have some of the imaging capabilities such as CAT scanning or MRI, or some of the medications that we have available to us in the emergency department. So I think for those minor bumps and bruises or less serious questions, I do think your primary care doctor and an urgent care is an excellent resource. I think for anything above that that's a concern, you probably need to come to an emergency department.
If you're still on the fence, here are some warning signs. He says if you have access to a blood oxygen meter, watch the numbers closely. If the numbers consistently fall below a 92 or 93, you should probably get checked out at the emergency room. Same for children. As for wait times at the ER, this is going to vary. For example, if you look at the Valley website, you can see just how long the wait times are at each of their hospitals. While the numbers look good, this isn't how long you have to wait to see a doctor. This is how long it will take for triage, where you're asked a number of questions about your symptoms and what you're feeling. The rest of your visit depends on how sick you are.
Triage times always vary depending on what day of the week it is and whether it's a busy time of the afternoon or evening. I do think the important thing to remember is we always take care of those individuals that are the sickest or have the biggest emergency first. So we do have a way of identifying those individuals very quickly, and those individuals are quickly seen always.
If your symptoms happen to get worse as you're waiting inside the ER, it's important to tell the triage nurse.
I think the challenges of the Omicron variant is being able to identify appropriately those patients that are well enough to go home and manage themselves at home and follow up with their primary care doctor or an urgent care, and then identifying those patients that potentially could become sick or get sicker quickly, and that we want to bring those patients into the hospital to keep an eye on them.
As for equipment inside a Valley Hospital, Dr. Davidson says they're doing well.
Right now, we are able to manage all of our respiratory illness patients very well, and there's no shortages of any of the equipment that we need to manage them, and there's no lack of space to manage them. We're doing very well managing all those patients.
And if you're fortunate enough to be healthy, Dr. Davidson reminds everyone to do their part. Keep your masks up, social distance, wash hands, and if you can, donate blood. To stay informed, just go to lasvegasnevada.gov/coronavirus for the latest information.